So let's start with a case. This is a 22-year-old man who presented with extensor posturing and a fixed and dilated right pupil. So basically, young man who came in and was herniating. And up here in the upper left-hand corner, you can see the head CT, a non-contrast head CT with a large hemorrhage, which is the bright spot there. So large intraparenchymal hemorrhage with a little bit of intraventricular hemorrhage. This is a CTA that was done to evaluate the cause of the hemorrhage, and you can see here what looks like a tangle of blood vessels, and that's the AVM. So this patient was taken emergently to the operating room for evacuation of the hematoma and a resection of the AVM. This is an intraoperative photo. You can't see it real well because the AVM is a little bit deep. It's underneath there. And at 7 months post-op, he did very, very well. Despite presenting in a deep coma, he was basically intact except for a little bit of decreased left arm sensation and a little bit of decreased fine motor movement of the left hand. So this kind of gives you the gist of a typical presentation of a patient with an AVM. Now, AVMs are one of the 4 major types of vascular malformations that are found in the brain. The most common type of vascular malformation would be a venous malformation. So these are things such as developmental venous anomalies, for example. And that prevalence there is about 3% of the population, to less common things like cavernous malformations, capillary telangiectasias. Arteriovenous malformations are actually the least common or the least prevalent of the vascular malformations, making up roughly 0.1% of the population, although the number really varies quite widely depending on which paper you look at, anywhere from 0.005% to 0.6% of the population. Now, what is an AVM? An AVM is a high-flow vascular malformation that consists of direct connection between arteries and veins. Now, as you know, arteries in a normal organ, arteries become smaller arterioles and finally become capillaries to feed the organ before they come together again to form veins. In an AVM, there is no capillary bed, so you have a direct connection between arteries and veins through these very dilated dysplastic vessels that form what's called the nidus. So the nidus is the tangle of vessels that you see. Now let's go over, and in this nidus, not only is there no capillary, there's also no brain, so no brain parenchyma. Here's some basic terminology when people talk about AVMs. So we talk about the nidus, which is the actual AVM. There's the feeding artery. These are the vessels that feed the AVM, meaning they bring blood to the AVM. And then there's the draining vein, which brings blood away from the AVM. Now, there are other things, entities nearby, which you may hear about when people talk about AVM. These are enthesiage arteries. These are blood vessels that eventually feed the brain, but they also send little branches to the AVMs like these. There are basically unrelated vessels that happen to pass by. These are just adjacent arteries. Feeding arteries, on the other hand, end in the AVM, so they don't go on to feed anything else. Okay, so basic terminology.
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.